Question number 1. Which action is most effective in preventing the spread of hospital-acquired infections? The correct answer is option A, proper hand hygiene. Question number 2. What is the recommended duration for hand washing with soap and water? The correct answer is option C, 20 seconds. Question number 3. Which PPE item should be removed first after providing care to an infected patient? The correct answer is option A, gloves. Question number 4. Which type of isolation is required for a patient with pulmonary tuberculosis? The correct answer is option B, airborne. Question number 5. What is the first step after a needle stick injury? The correct answer is option B, wash the area with soap and water. Question number 6. What is the primary goal of medical asepsis? The correct answer is option B, reduce the number of microorganisms. Question number 7. What statement best describes surgical asepsis? The correct answer is option A, practice of keeping item free from all microorganisms. Question number 8. Which patient requires protective isolation? The correct answer is option B, patient with neutropenia. Question number 9. Which disinfectant is most commonly used for cleaning blood spills? The correct answer is option B, sodium hypochlorite. Question number 10. Which action minimizes the risk of falls in elderly patients? The correct answer is option C, keep floor dry and clutter-free. Question number 11. What is the correct sequence for removing PPE? The correct answer is option A, gloves, goggles, gown, and mask. Question number 12. Which of the following is an example of a droplet-borne disease? The correct answer is option B, influenza. Question number 13. When handling biohazard waste, the nurse should use bags of which color? The correct answer is option C, red. Question number 14. Which practice should be avoided when moving a patient with a spinal injury? The correct answer is option B, bending at the waist. Question number 15. What type of precaution requires a negative pressure room? The correct answer is option C, airborne. Question number 16. What is the first step after spilling blood on the floor? The correct answer is option B, pour 10% bleach solution. Question number 17. Which procedure requires the use of sterile gloves? The correct answer is option A, inserting a urinary catheter. Question number 18. Which safety device prevents electrical shocks to stop in patients? The correct answer is option B, grounding system. Question number 19. Which practice prevents cross-contamination during wound dressing? The correct answer is option B, wearing gloves and changing them between sides. Question number 20. What sign indicates a need for immediate isolation of a patient? The correct answer is option A, cough with blood-stained sputum. Question number 21. Which practice helps in preventing needle stick injuries? The correct answer is option B, using safety engineered devices. Question number 22. Which solution is used for sterilizing surgical instruments? The correct answer is option A, glutaraldehyde. Question number 23. Which precaution is necessary when collecting a sputum sample for tuberculosis testing? The correct answer is option B, use of N95 respirator mask. Question number 24. Which of the following disease requires droplet precautions? The correct answer is option B, influenza. Question number 25. Which action should be taken first in case of a fire in the hospital? The correct answer is option B, rescue the patients. Question number 26. Which infection control measure is essential when inserting an IV line? The correct answer is option A, use of sterile technique. Question number 27. What type of infection developed due to long-term urinary catheterization? The correct answer is option C, urinary tract infection. Question number 28. Which color-coded bin is used for disposing of used syringes? The correct answer is option B, red. Question number 29. What is the main purpose of a safety data sheet, SDS? The correct answer is option B, to describe chemical hazards and safe handling. Question number 30. Which method is best to prevent infection during wound dressing change? The correct answer is option A, using sterile gloves and equipment. Question number 31. Which step is essential before performing surgical hand scrub? The correct answer is option A, remove all jewelry and accessories. Question number 32. Which of the following prevents the spread of infection through respiratory droplet? The correct answer is option B, covering mouth while coughing or sneezing. Question number 33. Which safety principles should be followed when lifting heavy patients? The correct answer is option A, keep back straight and bend knees. Question number 34. Which infection can be transmitted by a needle stick injury? The correct answer is option A, hepatitis B. Question number 35. Which PPE is mandatory when caring for a COVID-19 patient? The correct answer is option B, mask, gloves, gown, and face shield. Question number 36. Which item should be used to clean surfaces contaminated with blood? The correct answer is option A, sodium hypochlorite solution. Question number 37. Which is the correct sequence for donning PPE? The correct answer is option A, gown, mask, goggles, gloves. Question number 38. What type of isolation precaution is needed for a patient with C. difficulties infection? The correct answer is option C. Contact. Question number 39. Which of the following is the safest way to dispose of a used needle? The correct answer is option C. Placed directly in puncture-proof sharp container. Question number 40. Which tip helps reduce radiation exposure in X-ray department? The correct answer is option B. Wearing a lead apron. Question number 41. Which precautions should be taken when handling contaminated lines? The correct answer is option B. Hold linens away from the body. Question number 42. Which infection requires airborne isolation? The correct answer is option B. Measles. Question number 43. Which is the best way to move a heavy patient in bed? The correct answer is option B. Ask for help or use mechanical lift. Question number 44. Which of the following is an example of a nosocomial infection? The correct answer is option A. Wound infection after hospital stay. Question number 45. Which step ensures safe disposal of infectious waste? The correct answer is option B. Mix with normal garbage. Question number 46. Which practice ensures needle safety after injection? The correct answer is option A. Recap the needle using two hands. Question number 47. Which patient care practice reduces risk of pressure injuries? The correct answer is option A. Turning patient every 2 hours. Question number 48. Which PPE is essential when handling chemotherapy drugs? The correct answer is option B. Double gloves, gown, and mask. Question number 49. Which factor increases risk of healthcare associated infection? The correct answer is option B. Prolonged use of invasive devices. Question number 50. Which step ensures safety during oxygen administration? The correct answer is option C. Avoid electrical spark near oxygen. Question number 51. What type of mask is required for airborne precautions? The correct answer is option B. N95 respirator. Question number 52. Which practice prevents back injury during patient transfer? The correct answer is option A. Keep feet wide apart and left with legs. Question number 53. Which infection is transmitted by a droplet larger than 5 microns? The correct answer is option A. Influenza. Question number 54. Which method is used to sterile surgical instruments? The correct answer is option A. Autoclaving. Question number 55. Which statement is true about contact precautions? The correct answer is option A. Gloves and gown are worn for all patient contact. Question number 56. Which measure reduces transmission of multi-drug resistant organism? The correct answer is option A. Proper hand hygiene and isolation. Question number 57. Which of the following is a blood-borne pathogen? The correct answer is option A, hepatitis B virus. Question number 58. Which practice prevents patient falls in hospitals? The correct answer is option A, keep call bell within reach.